Hi there, I'm Rick Olderman, a physical therapist and author of Pain Patterns, Why You Are in Pain and How to Stop It. If you've been dealing with chronic back, sciatic, or SI joint pain, you've come to the right place. This is the 13th video in my Pain Patterns book series, and if you haven't seen the earlier videos, I highly recommend starting from the beginning. Each one builds on the last, giving you a complete understanding of why you're in pain and how to address it. Today, we're focusing on something we all do every day, bending. Whether it's washing dishes, brushing your teeth, or picking up objects from the floor, your bending habits could be a hidden source of your pain. Let's dive in. Let me tell you about Sandy. She had been dealing with back pain for years and had made great progress addressing her side bending and extension problems using the techniques I teach in my Pain Patterns book. But her pain persisted during everyday chores like vacuuming and washing the dishes. When I watched her mimic these tasks, I noticed that she was locking her low back into an arched position while bending forward, an extension problem habit. Once I taught her to relax her spine and change her foot position, she could vacuum and clean dishes without pain. It was a game changer for her, and it could be for you too. Bending correctly is critical and is often one of the last things I teach people because this seemingly innocuous task is actually quite complicated. It involves nearly every joint and muscle in the body. We have particularly strong mental programs in our brains because it's such a common behavior. But what worked for you 20 years ago may not be working for you now because of slow, hidden changes in your body that have taken place over the years and which your brain has hidden from you by compensating for them so you can go about your day. Now, let's test your bending habits. You may even want to record yourself on your phone for a clearer look. Once you're done, note your answers. Stand at your kitchen or bathroom sink, bend slightly forward to turn on the faucet, then return to an upright position. Bend forward again to turn it off. Pay attention to your foot position and how your lower back moves during this motion. Were your feet side by side, or were they staggered, with one foot slightly forward? Did your lower back stay rigid and arched, or did it flex and soften as you bent forward? If your feet were side by side and your back stayed arched, you may be reinforcing an extension problem, one of the most common pain patterns I see. This posture focuses excessive stresses on the L5-S1 junction, which can worsen back or sciatic pain. Most people with an extension problem find standing up straight after bending over to be more painful than actually bending forward. I mentioned this in Chapter 2 video. Staggering your feet with one foot slightly forward can unlock this pattern. Shifting your weight onto the forward leg and allowing your lower back to soften distributes forces more evenly, reducing pain. This technique can also be applied to bending for other tasks, like picking something up off the floor. It's a small adjustment, but it can make big differences. If this test reveals a bending habit that might be fueling your pain, don't worry. There's a lot you can do to address it. In my book, Pain Patterns, Why You Are in Pain and How to Stop It, I provide more detailed solutions to correct these issues and more. Remember, bending is something we do all the time, so getting it right is critical for lasting relief. If you found this helpful, please like, share, and subscribe to help others discover this information. And don't forget to check out the earlier videos in this series to fully understand your pain patterns. I'll see you in Chapter 14, where we'll explore how upper body posture and habits tie into your neck pain or headaches. Take care, and I'll see you next time.